ಬಂದ್ರು ನೋಡ್ ಮತ್ತೆ.
Okay, so we are discussing about the antipsychotic phenothiazines. So you can see here, this is the structure of promazine. Promazine is a phenothiazine. So in this phenothiazine, based upon the substitution in the second position. So you can see here, in most of the compounds, the second position substitution is present. Okay, so based on the substitution at the second position, you get the different phenothiazine derivatives. So this is the structure of the basic phenothiazine ring with substitution in the nitrogen atom at the 10th position. So you can see these three compounds, chlorpromazine, promazine and triflupromazine. They are related. The only difference between these three structures is in compared to promazine, this chlorpromazine, it has an extra chlorine atom. You can see here, there is a chlorine atom in the second position. Okay. Then in triflupromazine, the second position, there is the trifluoromethyl group. So CH3 is methyl, right? So when the three hydrogen atoms, they are substituted by fluorine atoms, you get the trifluoromethyl group. So this is the structure of triflupromazine. Now this thioridazine, if you see this thioridazine, the methyl thio, so it is CH3S. So methyl thio group is present, and here it consists of a heterocyclic ring, that is the saturated form of pyridine ring, okay, which is nothing but the piperidine ring is present here in thioridazine. Okay, then in piperacetazine, if you see the differences here, there is a, in the second position, there is an acetyl group, CH3 double bond O. An acetyl group is present. And here the heterocyclic ring, if you see the heterocyclic ring, it consists of the pyrazine ring. Sorry, piperazine ring is present. Okay, the piperazine ring is present uh, in the side chain. Okay, so if you see these three compounds, piperacetazine, prochlorperazine and trifluoroperazine, they are related. Okay, so these three consist of the piperazine ring in the side chain. Okay, but the substitution is different. So here it is the CH2 CH2OH group, whereas here it is the methyl group which is present. Okay, and in prochlorperazine and trifluoroperazine, these two are related to each other. The only difference is in prochlorperazine, the second position, it consists of the chlorine atom. Trifluoroperazine, in second position, it consists of the trifluoromethyl group. Okay, so these two are related to each other. Whereas this one, piperacetazine, there is an acetyl group. Okay, so this is about the structure of the different phenothiazines. Now we'll come to the what are the uses of the individual phenothiazine derivatives. So when you come to chlorpromazine, so already we have seen the structure of chlorpromazine. Okay, so you can just see here in chlorpromazine structure, in the second position there is a chlorine atom. So chlorpromazine Chlorpromazine is an antipsychotic which is used to treat psychotic disorders such as schizophrenia, then bipolar disorder, then severe behavioral problems in children, that is mainly the children with attention deficit hyperactivity disorder. Okay, so this particular drug, it is an antipsychotic which is used to treat different psychotic disorders. Like, for example, if you take bipolar disorder, so already in the previous class we have seen what is bipolar disorder. There will be two phases will be seen. One is the excitatory phase and another is the depressive phase. Okay, then it is also used to treat ADH is nothing but attention deficit hyperactivity disorder, that is mainly in children. So they will be the children who are having this ADH, they will be having difficulty in concentrating. Learning disabilities will be also seen in such children, and they will be hyperactive also. So such kids, they will be little uh, uh, they'll have little difficulty in learning, and all, or learning disabilities will be seen in such children. Then apart from this, it is also used to treat nausea and vomiting, then anxiety before surgery, that is the person who is going to undergo surgery, in order to reduce the stress and anxiety, this particular drug is used.
Monzer, mute your voice.
Then it is also used in hiccups. Hiccups is nothing but it is the involuntary contraction of the diaphragm, which is followed by closure of the vocal cords, which will result in a hic sound. So in order to control hiccups also, this particular drug is being used. Then apart from this, chlorpromazine, it is used in severe migraine. In smaller doses, it is used to treat nausea, that is mainly in uh, the people who are treated with opioids in cancer, for relieving pain during cancer therapy. Okay, to reduce the pain, they'll be giving opioids as an analgesic. So that will be related to nausea. So in order to prevent that nausea, it is being used. Then if you see the side effects, it causes movement problems. Okay, then sleepiness, dry mouth, decrease in blood pressure. These are all some of the side effects which is related to chlorpromazine. And this particular drug, it is a dopamine antagonist, a D2 antagonist. It also has anti-serotonergic properties, that is, it will counteract the effects of serotonin, and it also has antihistaminergic properties, that it will block the effects of histamine at the H1 and H2 receptors. So these are the uses of chlorpromazine. So mainly it is an antipsychotic. Then apart from this, it can be used in behavioral problems in children like ADH, then treatment of migraine. Okay, these are all some of the uses of chlorpromazine. So now we come to the synthesis of chlorpromazine. So you can see here. So the first step is synthesis of 2-chlorophenothiazine. So here we are taking 3-chlorodiphenylamine. Okay, so this 3-chlorodiphenylamine, it is being treated with sulfur in the presence of iodine. When this mixture is being heated, it will result in the formation of 2-chlorophenothiazine. Okay, so this is the synthesis of 2-chlorophenothiazine. The second step, this 2-chlorophenothiazine. Okay, so this is the first portion, this is the second portion. This 2-chlorophenothiazine, it is being treated with 3-chloropropyl dimethylamine. So if you number this 1, 2, this is 3. This is 3-chloro, this 3 carbon, it is propyl group. Then dimethylamine. Okay, so when it is being treated with 2-chlorophenothiazine, this the hydrogen atom which is indicated in red, and this chlorine atom will be removed, and this group will be attached to this nitrogen atom. So you can see here, So this is nothing but the structure of chlorpromazine or chloropromazine. Okay, so this reaction, it is being the refluxing in the presence of toluene and sodamide. Okay, sodamide is NaNH2. Now next drug is promazine. So you can see the structure of promazine. So it is also a phenothiazine derivative which is used as an antipsychotic. It is used for the treatment of schizophrenia and it has anticholinergic side effects. And this particular drug, it is not because of the side effects, its use is restricted, but it is used for veterinary purpose in the name of promazine and tranquazine. Now the next drug is triflupromazine. So you can see here. So there is a trifluoromethyl group which is being present. This is a trifluoromethyl CF3. Okay. So it is an antipsychotic. It is the phenothiazine derivative. It is mainly used in severe emesis. Emesis is nothing but vomiting. Okay. And severe hiccups. So hiccups already we have seen. Hiccup is nothing but it is an involuntary contraction of the diaphragm which is followed by closure of the vocal cord which will result in a hic sound. Okay. So this particular drug, it is used in emesis or vomiting and also it is used in the treatment of severe hiccups. So generally sometimes hiccups will be controlled by some remedies. You drink water and all home remedies you do. You drink excess of water, you raise your head and all those things. So in some cases what will happen is this hiccups, it will not be stopped. It will be continuing for a longer time. In such cases you have to take the medication. Then because of its side effect, this particular drug, it is not much used in antiemetic therapy. These are the side effects which is caused by this drug. One is akathisia. Akathisia is nothing but restlessness and inability to sit still. So a person cannot sit still in a particular place. He'll be either shaking his leg or some body movements will be done. Okay, so that is one of the side effect. Then next is tardive dyskinesia. So tardive dyskinesia is a side effect which is related to most of the antipsychotic drugs on long-term use. So tardive dyskinesia is nothing but the involuntary movement of face and jaw. Involuntary movement means we cannot control. If you want to stop that also, you cannot control. Okay, so the face, jaw, like that, it will be the movement, involuntary movement will be seen. Okay, so and apart from that, it will also lead to neuroleptic malignant syndrome. So neuroleptic malignant syndrome is nothing but it is a little fatal or it is little serious condition. That is, it will there will be high fever will be there, then variation in the blood pressure, heart rate, the muscles will become rigid. Okay, so like that there is various severe, then confusion states. So these are all the symptoms of neuroleptic malignant syndrome. So these are all seen in long-term use. Okay, so triflupromazine is an antipsychotic which is used in emesis or vomiting and hiccups, but its use is restricted because of the severe side effects like akathisia, then tardive dyskinesia, then and neuroleptic malignant syndrome. Now thioridazine. So you can see here thioridazine. There is a, in the structure if you see, there is the methyl. Thio is sulfur. Methyl thio group is there. So thioridazine hydrochloride. So it is also the phenothiazine, first generation antipsychotic drug which is used in the treatment of schizophrenia and different types of psychosis. Okay, so this particular product, it was withdrawn from the market in 2005, mainly because it causes severe cardiac arrhythmias. Arrhythmia is nothing but the improper rhythm of the heart. Okay, so because of the side effects, its use is restricted. Then it can also be used in treatment of various psychiatric symptoms seen in people with dementia. So those who are having memory loss and all, in such people, uh, it can be used for the treatment of psychiatric symptoms. So that is the uses of thioridazine. Next drug is piperacetazine. Okay, so so here the you can see here there is a acetyl group CH3 C double bond O. Acetyl group is there. Okay, and here it is the piperazine ring which is present. So it is piperacetazine. So name itself you can remember by the substituent, because the phenothiazine ring is similar in all the compounds, only they vary in the substitution which is being present. So this piperacetazine, it is an antipsychotic prodrug, and it is mainly used in schizophrenia and other mental illness which is characterized by relapsing episodes of psychosis. So relapsing episode is nothing but when you take the drugs, the psychosis will be controlled for a particular duration, and after some time it can again occur. Okay, when you reduce the dose and all those things, it will again relapse or it reoccur will be taking place. Next drug is prochlorperazine. So this prochlorperazine, it is nothing but it is a drug which is used to treat schizophrenia, nausea, and anxiety. So this particular drug also it leads to many side effects like movement disorders like tardive dyskinesia. Already we have told, involuntary movement of the face, jaws. Okay, and certain parts of the body. The neuroleptic malignant syndrome we have already seen, that is it is a serious condition which can lead to high fever, variation in BP, variation in the heart rate, confusion states, etc. It is also used to prevent vomiting, which is caused by chemotherapy, radiation therapy. Okay, chemotherapy, radiation therapy, that is mainly in people who are undergoing cancer treatment. So this particular drug, it is used to prevent the vomiting which occurs due to during the radiation therapy.